Hi, Ms. Thompson. My name is Kristen. I was the pharmacist who filled your son's Sess prescription today, and I just see that this is a new prescription for him, so I was wondering if you had a few minutes to talk about it to make sure that we give it to him the right way.
Oh, absolutely.
Okay. I just need to verify some information quickly. What is your son's date of birth?
June 10th, 2011.
Okay. And his address, please?
25 Sheridan Avenue in Dedham, Mass. 02115.
Okay. Great. Before we get started on this specific medication, what drug allergies does Seth have?
None.
Okay, great. I see in his profile that he's currently taking a multivitamin.
Mm-hmm.
Does he take any other medications, like over-the-counters or herbals, or any other prescription medications?
Occasionally we'll give him Dimetap just for some congestion from allergies, and for teething we'll give him some like acetaminophen, Tylenol.
Okay, awesome. Those won't have any interactions with this prescription, so that's great.
Yes, good news.
Does he have any health conditions besides the ear infection today?
No.
Okay, awesome. So Dr. Richardson prescribed him Zithromax, oral suspension, 2,000 milligrams per 5 milliliters, which is the generic of azithromycin. What did the doctor tell you about this medication?
Nothing, just that it was for the ear infection.
Okay. So this is an antibiotic, which should clear up his ear infection within a few days. Did he explain how to administer this medication?
No.
Okay. So you're going to give him 1 teaspoon by mouth today when you get home, and then 1/2 teaspoon by mouth for the next 4 days.
Okay.
And that'll bring you to the 5 days.
Mm-hmm.
Seth may start to feel better in a few days, but make sure that you finish the 5 days of the prescription.
Okay.
He prescribed 15 milliliters of the suspension, which would mean that he has enough to finish the bottle. But if for any reason that you have some left over, I would discard that within 10 days from today.
Okay.
There are no refills on this prescription, so after he's done, that's it. Make sure when you are giving him his dose that you shake the bottle before you administer it, and place the bottle in a dry place, so make sure it's not in your bathroom.
Okay.
You can also give it to him on an empty stomach or with food. So I guess next we'll talk about the side effects that he would experience. Did Dr. Richardson talk to you about any of the side effects that he might experience?
No, nothing.
Okay, so some kids experience diarrhea, nausea, belly pain, vomiting, and heartburn. But these are normal, and I would suggest if he experiences any of them to give the following doses after that day with food. That
Okay.
will help some of the symptoms. And if he has any other severe side effects or anything else that pops up, I would call Dr. Richardson just to make sure that everything's okay.
Okay.
Also, if he experiences loose stools, you can give him yogurt or probiotics, and that might help counteract that side effect.
Oh, that's good information.
What did Dr. Richardson tell you about if he misses a dose?
He didn't.
Okay, so it's pretty important to remember that if he misses a dose, to give it to him when you remember. But if it's too close to the next dose, just skip it, and then the next day get back onto the regular schedule.
Okay.
Don't double up on doses.
Gotcha.
I know I've given you a lot of information.
Yeah.
So I was just wondering if you could repeat some back to make sure that I've explained everything correctly.
Yes, I sure can. So I'm going to give him 1 teaspoon, right? 1 teaspoon
1
today
teaspoon.
when I get home.
Yep.
And then 1/2 teaspoon for the next 4 days, every day.
Awesome.
I'm going to shake the bottle to make sure that it's all mixed up well. And I'm going to store it at room temperature in a dry place. And then I'm going to make sure I give it all to him. And if we miss a dose, I'll give it to him as soon as I remember, but I won't double up. If it's too late, I'll go to the next day.
Okay, awesome. Sounds like you have a great handle on this.
Yeah.
So, what questions do you have for me today?
None. I think you've been really thorough.
Okay, thank you so much. My information is on the bottle, also the pharmacy's information. So if you have any questions, you can call and ask for me or any other pharmacist. They'd be happy to help. So
Thank you
that's
so
all I have for
much.
you today.
Appreciate it.
All right, have a great day.
Bye.
Bye.